Hi, my name is Daisy Doherty and I'm a doctor of physical therapy here at St. James, and I'd like to talk a little bit about pelvic floor physical therapy. So pelvic floor PT is specialized treatment for the pelvic region. So you have muscles that attach right at the pelvis and they support your bowel and bladder as well as aid in sexual function. So when you have these muscles and they become too weak or too tight, this can contribute to symptoms that lead to urinary incontinence or even pain with sexual intercourse. So we do treat women of all ages, whether that's childbearing years all the way up to postmenopausal, as you can see many different diagnoses all the way from those years, such as pelvic organ prolapse, urinary incontinence and frequency, and many more. So during treatment, the goal is to really find out what is the root cause of your symptoms, and we really want to find the appropriate plan of care. So that might include manual treatment, breathing techniques, and showing you some therapeutic exercises that can really find out and improve the limitations that you're having. Treatment time for each patient is going to be different. It's not a one-size-fits-all treatment plan. Some people may start to see improvements in their urinary frequency or incontinence within 1 to 2 sessions. Other people, it might take a little bit longer. It really just depends on what you're coming for. So what really got me interested in the women's health and pelvic PT was actually having a conversation with my colleague Christine. When I first started as a relatively new grad, she had told me about the continuing education that she had already done, so it really got the ball rolling for me. And the more I learned about it, the more I found out of how common it is for people to have these symptoms, and it's so common, and it shouldn't be something that you're embarrassed to go get treatment for, because it's your daily life. You want to take charge of that and really get the treatment that you need, and I'm just happy to be able to provide that for people.